research shows is that most children who are diagnosed with cancer and go through treatment are hardy. We don't see a lot of distress in these individuals, and I'll talk more detail about that in just a few minutes. But we do see some evidence of delayed distress when survivors of childhood cancer hit young adulthood. Most parents and siblings show resilience, so there's definitely a period of distress, but then they get better. And there's growing evidence of enhanced functioning in all types of family members. So this journey of childhood cancer, of course, starts with diagnosis. And diagnosis can be a very stressful period. And in fact, parents often tell us that it's the diagnosis that's the worst part. There's a range of expected strong emotions that happens across family members around the time of diagnosis. Oftentimes, the news of the cancer starts out with shock, disbelief, maybe even denial. There's a lot of confusion and frustration. It's kind of like, what's going on here? I just brought my child in for a well child visit and now we're in the PICU. It just doesn't make sense. There's a lot of anxiety, fear, and helplessness. Of course, there's sadness, mourning, and grief. There's a real sense of loss around the time of diagnosis. And then a lot of guilt and anger. So many family members tend to blame themselves for something that they clearly could not control. In terms of parents' responses, within 2 weeks of diagnosis, 85% of parents report significant distress. So it's just very common. Parents with children with cancer shortly after diagnosis have more anxiety, poor quality of life, and more symptoms of depression than parents of healthy children. Within 1 month of diagnosis, we found that just over half of moms and about 40% of dads qualify for a diagnosis of acute stress disorder. And within 1 month of diagnosis, 70 to 80% of parents report at least one symptom of re-experiencing, one symptom of avoidance, and one symptom of arousal. So these types of symptoms and distress are nearly universal. The reactions of the child with cancer to diagnosis really vary depending upon his or her age. Of course, adolescents who understand more about cancer just when hearing about the diagnosis or have beliefs about cancer respond differently than a child who has no idea what cancer means or no preconceptions. We do see some symptoms of anxiety, fear, and sadness that are common. Children may show some developmental regression, so children who had been potty trained may not any longer. The younger kids may become afraid of the dark again. But overall, the research does not indicate increased rates of depression or traumatic stress symptoms in patients shortly after diagnosis. So as I said, these kids look pretty hardy. You'll see little flares of difficulties, and generally that's around specific events, like getting a needle stick or preparing for surgery, but the diagnosis itself doesn't seem to be as traumatic to them, especially not compared to their parents. Siblings around the time of diagnosis report that they feel lonely, marginalized, jealous, and that they worry. Within 1 month of diagnosis, almost 60% of siblings report impaired emotional quality of life. So they're saying that they feel a lot of negative emotions, and they're not feeling a lot of positive emotions. Nearly 40% of siblings report significant difficulties with memory, concentration, and learning within 1 month after the cancer diagnosis. But rates of traumatic stress symptoms have really been unexplored in siblings so far, this close to diagnosis. If we look at the entire family, marital distress is common around the time of diagnosis. So about 40% of married parents indicate some distress in that regard. Parenting stress is very typical. Parents may become more overprotective, more impatient. Sometimes they relax rules and report inconsistency in discipline. and that's about a third of fathers and almost half of mothers indicate that that's the case. Families also have a report pulling closer together. They feel more tight-knit. They kind of round up the troops. And emotionally, they feel closer to one another. And that happens in about 60% of families. Now, some of these families also report an increased rate of conflict with family members, which you would expect if you're kind of pulling in closer to one another. Around the time of diagnosis, overall benefit finding and traumatic growth, kind of that positive side of trauma, have been unexplored. So after diagnosis, of course, you move into treatment, and sometimes this can happen very quickly. Treatment can involve many invasive procedures, and suddenly the child may seem more sick than they did before cancer. This is a very difficult time for families, but also, as treatment moves on, things get better. So the cancer may go into remission pretty quickly. You start to get used to all the terminology. You start to accept the unpredictableness of the disorder and have some idea about what to expect. So during treatment, 2/3 of parents report that dealing with their own intense emotions and traumatization is the greatest challenge that they face. Feelings of helplessness, powerlessness, and lack of control are common early on and then get better. And anxiety and depression symptoms that were very high around the time of diagnosis decrease within the first 3 months, but still remain significantly elevated. At about 6 months post-diagnosis, about half of parents continue to report high levels of distress. And about 44% of parents still qualify for a diagnosis of PTSD. By 1 year after diagnosis, 68% of moms and 57% of dads report moderate to severe post-traumatic stress symptoms. So again, these remain very common. By 24 months post-diagnosis, levels of anxiety and depression tend to be back to normative levels for most parents, but there is still a subgroup that have continuing distress. During treatment, children with cancer continue to show little or no evidence of emotional or behavioral problems. But again, there are going to be times of difficulty when they're feeling more ill or when they're going through more stressful procedures that may lead to behavior problems and emotional outbursts, things like that. Some reports suggest that as a group, kids with cancer on treatment have lower levels of depression and anxiety than healthy children. And this is really interesting because there's a lot of kind of conjecture why would this be. And some researchers think that kids with children with cancer have a different perception of the world, and suddenly what they know as bad is much worse than what any other kid knows. So day-to-day life, when it's okay for a kid with cancer, is pretty good to them. There are other researchers who think that kids with cancer tend to have this repressive coping style, where they say that everything is more positive than they actually believe. But there's no real evidence of that either. These kids seem to be doing well, they seem to be happy, there seems to be no real detriment long term of taking that approach and being positive. There are some traumatic stress symptoms present for kids during treatment, but the mean levels of their traumatic stress symptoms are, again, no different from healthy children. Now, for siblings, the disruptions in the family life really start to take a toll on them. The specific things that bother them are just the absence of their brother or sister, separation from their parents, and just confusion about what's going on. There's a 3-fold increase in behavior problems for siblings and a 2-fold increase in emotional problems by parent report. So if we ask parents, how were your siblings behaving before the cancer versus after, we see this increase in problems. They also self-report decrements in their quality of life, and they show a decline in school performance, usually within the first 2 years after diagnosis. Also within this 2-year period, about 25% qualify for a diagnosis of PTSD, and 60% report symptoms in the moderate to severe range. Siblings also report positive aspects of the experience. I'll get more into detail on that in a little bit. In terms of kind of the family as a whole, significant marital distress continues to be reported in about a fourth of parents throughout the first year post-diagnosis. Inconsistent discipline continues, and this is often because parents feel a bit guilty about putting their child through treatment. Role overload is common. Once you start going through treatment, you have to renegotiate your roles and responsibilities, and sometimes these new roles added to old ones just become overwhelming. And parenting stress, we find increases once the child reaches remission. So actually when the kid's doing better, that's when parenting becomes more of a problem. So hopefully always the last stage of this journey through cancer results in survivorship. The end of treatment can actually be a very difficult time for families. There's relief and joy that you're getting through it and you've reached a milestone, but there's also this fear and uncertainty about, well, when is the other shoe going to drop? Is anything else going to happen? Plus, you no longer have as close contact with the medical team, so you might feel like you're not doing as much as you used to, and that can be unsettling. For most parents, depression and anxiety scores are no longer elevated, but again, there's a subset of parents who continue to have problems. However, traumatic stress symptoms do remain, and these are data from a few cross-sectional studies of families of adolescent survivors of childhood cancer. And we found that about 14 to 20% of moms reported current PTSD at the time we did the interviews. Almost 30% reported post-traumatic stress disorder at some time since the diagnosis, and up to 44% of moms report post-traumatic stress symptoms in the moderate to severe range. For dads, the numbers are a little bit lower, but 10% reported current PTSD, 12% reported PTSD since cancer, and about a third of them report post-traumatic stress symptoms in a moderate to severe range. Symptoms, that kind of gets at disorder, post-traumatic stress disorder, but these symptoms of post-traumatic stress are still very common. So nearly all moms and almost 90% of dads say that they still have thoughts about cancer popping into their mind or some other type of re-experiencing event. 64% of moms and 44% of dads report at least 2 symptoms of physiological arousal. So trouble sleeping, trouble falling asleep or staying asleep, still some of that hypervigilance, still keyed up, jumping in on edge. About a third of moms and 16% of dads report at least 3 symptoms of avoidance. What we see in these families is avoidance is often hard for families to accomplish. The needs during survivorship of coming back even yearly to clinic kind of make sure that you don't have the opportunity really to avoid maybe as much as you want to. Parents, however, also report positive outcomes of the experience. So 86% of moms and 62% of dads told us that there's a positive change in the way that they think about their life now that they've gone through the cancer experience. And 58% of moms and 48% of dads say there's been a positive change in how they treat other people.